welcome to a special episode of Bear Care Corner. We are here in our new studio, and we're going to be talking about the med box, which is right here.
There he is.
We're going to give everybody a few minutes to tune in as we say hello. This is
Nicole.
and my name is Andrea, and we're going to be coming at you live here in the main barn of our new property in Sheffield, Ontario, Canada, in our new studio. Let us know where you're tuning in from. We see Jerry Lee from Maine. Sound is very low. Sound is very low.
We're on it.
I don't know. Sound is very low. Let's check. Okay. Thank you, Gail.
Hopefully this is better.
We're having some technical difficulties. We're a minute late. Let us know if you can hear us now. We are live here in the main barn. We're talking about the med box. If you have any questions about the med box, let us know in the comments. Let us know where you're tuning in from. We will be answering questions live as they come up. Nicole just wants to give you a little disclaimer as we get started.
Yes. Oh,
Thank you, Gail.
Oh, Gail, we can always count on you.
Thank you.
Incredible.
We have technical difficulties today.
This seems to be working out, so excellent. So before we get started, just as a little disclaimer, we will just mention that all of the medications that we're using and talking about while filling our med box and everything that we have on site is all used under the guidance of our veterinary team. So these are all things that are recommended to us by our veterinary team, doses, frequencies, all that. So thank you to our excellent veterinary team who gives us a hand with all of that so we can provide all this incredible care on site.
It is key to have a good veterinary team.
Yes.
We wanted to start off with a little bit of trivia.
Ooh.
So this is our med box, and this is the AM med box. There's a few of these throughout the day, and first thing in the morning, that's when we do the most medications for the residents. You can see some of them lined up here. We're going to be filling our med box with these medications and talking about them as we go. But our first little bit of trivia. And now that some folks are tuning in, hi Helen, hi Sylvia,
Hey.
Helen again.
Amazing.
Our sound crew.
Yeah, thank you so much.
Our first bit of trivia. How much does it cost to fill the med box daily? So this is full of medications for the residents. We're going to let you get in the comments. We're going to put the correct answer up on the screen as soon as we see it. So if you have a answer to this question, let us know. And we're going to be giving you some facts and information about our med box. And we're just going to sit here and fill it and talk about the meds. So think about your answer. Let us know in the comments what you think. And
it's a really good question. Yeah, let's get to it.
You never know. It's like the size of a box. Does that give anything away? All right. This is our med box. We have med baggies, and these keep us organized.
Yes.
So this is a set of baggies with similar medications in it. They're all kind of clipped together, and these are all empty because they were used this morning just a few hours ago. So we're going to be, I think we'll take all of them out and then put them back in as we fill them.
Yes.
That's how I like to do the med box.
It's quite satisfying.
Oh, Sylvia, we have a guess. That is not the right one yet.
167, not yet. This was a really good trivia question because when I just learned the answer this morning, I was like, ooh, I actually did not know.
And this does vary. That's as of this morning.
Yeah.
It depends on who's on meds. Most of these meds, I would say, are long-term medications.
Yeah.
The residents who are on them for life, essentially, because they're pain meds for arthritis, for example. Some of them are short-term, but a lot of them are long-term. So it kind of hovers around this, the daily cost for these specific medications. And then there's one-off medications. There's medications midday, a few, and there's some PM medications, but not quite as many. So let's start with this one. What's this?
Slippery elm. So this, we've talked about a fair amount, I think, on social media because we use a lot of fig Newtons to hand out slippery elm. So slippery elm is something that we give to our goats and sheep as a GI protectant for those residents who are on long-term pain medication. So just to help reduce the risk of gastric ulcers. And that's something that comes every month from our Amazon wish list.
Yes, the majority of our slippery elm that we've ever used actually was donated. That's a great point from the Amazon wish list. We have our bottle here, and we have our baggie. So this one, for example, is Jeannie. And so this means as we're filling this, we're going to fill it now. Usually we do it a bit early today. Well, it depends.
Yeah.
These are filled and ready for the next morning. So each morning is typically a different caregiver. That way, when you start your morning, you can grab your med box. It's full of medications, and it's all ready to go for the residents.
Yes.
All right. We have 2 correct answers.
Ooh.
the med box. The cost to fill the med box, you can see it better from down the way, is $57.41. Helen guessed correctly, and Sylvia guessed correctly. So currently, right now, as we're filling it, this is $57.41 every day to fill all the medications in here. Wow. So they're all in little,
nice and easy
little containers ready to go. So when we make these, like Nicole said, there's 2 pills that go into a Fig Newton. The Ghost and Sheep actually don't mind the taste of this one, so in a Fig Newton itself is fine. I didn't even fill any of those. Not surprised, right, Gail? It's medication costs can be quite high. Veterinary costs can be quite high, and we do have an aging population. We will be talking about that all the time. Next one, this is a one-off. This is the only resident who's on this specific medication. It's called Previcox. What is Previcox?
So that is an NSAID, so non-steroidal anti-inflammatory drug. So that is for Escalade, our horse. So as he's been getting older, our vet and our farrier, who trims Escalade's hooves, have noticed some hind-end discomfort. So this basically is a pain medication just to help supply him with some relief.
Yeah, I remember when they noticed when they got to Escalade's back feet, even when Escalade was mildly sedated for a trim, there was a bit of hesitancy, and he noticed that a few times, so they suggested a little bit of pain relief. So that one is done, and it's going in the box.
Yes.
Exciting.
Yeah, it's always very satisfying to watch this pile get smaller and then the med box get more full.
So welcome if you've just tuned in. We are here filling our med box live. This is our AM med box, which is the most populated med box out of all of them. And as we fill the medications, we are going to talk about them.
Yes.
Who's next?
All right, next.
So messy one. I should have brought tissue.
I brought some.
Nicole's prepared. We have filled this enough. This is a supplemental oil that usually we were doing this not in this location. We have a medical room with all the supplies, our on-site pharmacy.
Yes.
So these things are normally on a shelf, labeled in different. What are the different categories of the shelves?
So we have pain meds, antibiotics, dewormers, topicals.
Natural supplements is one of them. Yeah, so kind of categorized, and then when we go to need a medication or fill a medication, it's pretty easy to find, and everything's inventoried.
Yes.
That's also helpful. So what are you pulling up? I see 2 syringes.
Yes, yeah. So this is like an antioxidant support that we give to Brindle and April just for some additional arthritis support. And this is something that was recommended to us by some sanctuary friends. So we just recently kind of added this to our protocol for these guys.
Yes.
And it is a little bit
natural supplement because they also receive, and we'll get into that, medication for their arthritis, but it's just something a little extra that we're trying for them.
Yeah.
Because arthritis is tricky, and there's no cure to arthritis. It's keeping the residents comfortable is the key, and that's usually with medication, sometimes with physio, sometimes with things like laser therapy. There are a few things that we can do, but unfortunately, once they get it, you're just trying to keep them as comfortable as possible. Yeah. We have another single. This is Bonnie, and we are going to be filling meloxicam, the tiniest amount. Once we fill it, I think I'm going to hold it up to the screen
you can barely
to compare. So tiny amount. This is oral, so you can see it in a syringe. You might assume that it might be injectable. I don't think we have any injectables.
No.
Usually we don't pre-fill injectables. You want to pull that the same day you're using it. This is Bonnie's. Nicole's going to use a microscope to fill it. Just joking. Hi, Irene. Welcome. You're here filling our med box. AM med box. This is Vonnie. Vonnie's a very small duck. Vonnie is she our smallest bird? Dorothy. So Bailey walked by and smiled. Bailey loves Dorothy. I feel like between Vonnie and Dorothy are probably similar size, and Dorothy's also on a microscopic amount of meloxicam.
Yes. Do you have the cap for this? Oh, excellent.
So caps are here. I don't know if you can tell because it's like a white liquid. That tiny amount, we cap it to make sure when it goes back in the bag that we don't accidentally squeeze. Plunge it out. That's we were having that issue a little for a while. We're like, syringe caps.
Yeah, not the full amount. When those syringe caps, life before that was wild. Things are so much better now.
Yeah. All the things you learn and discover. I think we got a batch of 1 ml syringes and they came with caps. We're like, what are these?
Yeah.
Next, this is the entire goat and sheep all clipped together. So when you go to do the meds, you're just kind of, yeah, it's all there.
Yeah.
So there's a mix of 2 different medications that are in here. So for example, we have a Diablo on gabapentin and meloxicam. And those are both for his arthritis. So some residents who are advanced arthritis get both.
Mm-hmm.
Somebody like Obama just gets the meloxicam for now, but if he had experienced more soreness, and I think it's mostly in his back legs, we would also add another medication. We have Gilbert, Jeannie. Jeannie's on both.
Yes.
Because she is an older lady.
Yeah.
So let's split these up.
Get started on these with some meloxicam.
Okay, I'll do the meloxicam.
Perfect. Oh, you got more. And then important to note with these as well, these both of these actually are called what's called like oral suspensions.
Ooh.
So basically it's fancy.
Nicole's going to demonstrate.
So basically it's like drug particles dissolved in a liquid. So the gabapentin, this is actually custom compounded as well. We have a couple medications that are custom compounded. So what that means is there is a custom pharmacy, thankfully not too far from us. So they basically
today from them.
So they basically make us custom compounded drugs. So what that means is certain medications in different formulas or different formats. So like a liquid versus a pill or the other way around, and different flavors as well. So basically to make the medications like the easiest to give to the residents, the most palatable.
Yeah,
the right
palatable, because the right dose is what I was going to say, because if you were doing pills, you can only split a pill so many ways.
Exactly.
This way we can get the exact mils. You'll see on some of these, 1.6 mils, 2.23 mils, even though we don't usually measure that. It's pretty hard to measure. So Nicole's going to do the gabapentin and do the meloxicam. We do need a new bottle, so hopefully we get our bottle's falling apart. We'll shake these up really well.
Oh yeah, so that's what I was saying, and I got distracted. Because it's an oral suspension, we shake them really well to basically mix the drug particles up in the liquid.
Reconstitute.
Exactly.
The gabapentin it specifically tends to separate and settle. When you go to use it, it might be settled more at the bottom. So what you're pulling up might not be the right dosing. So you have to shake it really well. Meloxicam isn't quite as bad like that, but we still want to shake it. Any medication that's liquid, these again are oral meds. And I'll show you the difference between this. This is a Gilbert, a Goat, and Bonnie that we just showed you.
Yeah.
This is hard to do talking at the same time. I know. Okay, 2.23. So we have Gilbert, his cap. So example, same medication as Vonnie, but and a bigger syringe too. That was a 1 ml syringe. So this is how much he's getting. He actually loves the taste of this. This is not particularly flavored. The other custom compound we can get vanilla and caramel.
This one's banana.
Somebody's Tributaline, which we're going to get into, is actually caramel flavored.
Yep.
And she asked me on the phone today when I ordered it. She's like, "Do you want caramel?" And I was like, "Yeah, I guess so."
Yeah.
So he actually will just put the
Slurp
syringe to his mouth, and he'll actually just kind of drink it like that. Yeah. So that's Gilbert. So those done already. Oh no, I'm behind.
I only had 2.
Okay. Got Jeannie's meloxicam 1.6 drawn up in the syringe. We have Obama meloxicam as well. So he's got some soreness in his back leg. He's 14, which is
he's doing really great for a 14-year-old.
And there's that.
Yeah.
So it's things like this, not chiro. He gets chiropractic.
He did, yeah. We've recently started that. He gets osteo as well.
And pain meds and supplemental feeding to some teeth.
Yes, if you
so
want to know.
If
you want to know more about Obama, tune in to go back and watch our video from, was that last week?
It was recent.
Yes.
Scroll back a little bit
the
on
Obama video. Yeah.
On Facebook. Hi, everyone. Hi, Caroline. Hi, Irene. So happy you're able to help them with pain control. That is a big relief for us to be able to offer this to them. And thanks to our donors, monthly donors, people who donate one time. This is all because of you. And we're able to do this for the residents because of you, because of our supporters, because of the folks in this chat right here, the people that are part of the Barnside chat and Bear Care communities. Thank you for all of your donations and time and interactions and comments. This all helps the residents. So that's a
we're so happy to have you here.
Yes, very nice. Another little fun fact about the med box: the number of residents currently on pain medications total is 19. There are 66 residents. Do you know that? 19?
That's no, not until just now.
When you like stop to think about it, like actually count the numbers.
Yeah, when I think about it, that makes sense.
Yeah.
The clip to keep everything organized.
Somebody actually actually this is all donated.
Yeah.
Somebody actually donated these and we got really excited because they're color coded and we love to be organized.
Yeah, I think actually we opened them, I think on a live video. I remember we were extremely excited.
Amazon wish list donation. Okay, Sammy. He has a baggie of glucosamine. Enrique just showed up. Hi, Enrique. Enrique, none of the things in this box are going to be for him, but in the evening he gets lysine and he gets Fortiflora, which is probiotic. Yes. He had some health issues when he first arrived. Some respiratory. What else was it?
We suspect that he has a feline herpes virus.
Yeah. So the lysine specifically is he hasn't had any flare-ups. He was going to the vet at one point. It seemed like every other month. So we started him on the natural supplements as well as the vet care that he received, and he hasn't had any flare-ups since. So Nicole's doing Sammy's. We're gonna show this. Look at barely closed. Yeah. Look at little Sammy's. So he gets 8 of these. So if you think, I think the human dose,
what topped out
is 2. So this would be how many?
Like 4 times
humans. Yeah, he would get 4 times that dose. So a lot of supplements that humans can take, or sometimes even medications, animals can also take. But we do consult with our vets ahead of time. We're not just giving them anything.
Yeah.
Hi everyone. Hi Laura. Thanks for tuning in. We're getting some new comments. If you have any questions about the med box as we are here filling it and talking about the medications, let us know in the comments and we will be answering them live and giving a few more little facts about the medications.
For Sammy, we can mention too, because it's quite recent that we've started him on glucosamine and some pain meds. So we're not doing pain meds for him daily. We've just started to notice things slowing down a little bit. He's a big pink pig. So it seems like he's aging a little bit quicker than the rest of his herd, even though he's not much older than that.
Maybe 8 months older. Yeah, but it's just his breed is so different.
Yeah. So like an important thing, and again, something we discuss with our vet team all the time, but just kind of managing the right amount of pain medications, but while also thinking about the side effects and the risks. So basically trying to do the least amount of medication, the least frequent, while still having like those good therapeutic effects. Balance. Exactly. So that's something that we're kind of just working on right now, because right now he's not getting pain meds every single day. But if this was a day that he was getting pain meds, then we would have that to fill for him as well.
Oh, we have our first question. I'm so excited. Thank you, Michael. So Michael is asking, do the animals ever reject the meds?
Yes. Not frequently, thankfully.
No, but the ones you're seeing us fill now, I can't think of any that would be rejected. They either, some of the goats, I did mention that Gilbert will kind of slurp up his syringe just like that. Otherwise, we do direct syringe to make sure they're getting the proper dose. Or in a fig Newton. The one that comes to mind for me is gabapentin pills with the pigs. They're super bitter. Sometimes if you have to give them like 2 or like a really small amount of pills, crush them up, add peanut butter, add them to a ton of food so they're all kind of dispersed. And we've given pigs like that and they still won't take it. So you got to be a bit creative while also knowing like which dose they're getting. So top of my mind, I would say gabapentin pills for the pigs. Have we ever had any?
That's the number one thing that sticks out to me. I remember we were trying to give Denver gabapentin, the liquid, like the oral suspension, the banana flavor once, and he did not like it. I remember I was like, he's for sure gonna like this. So I mixed a little bit in with some grain or some grass pellets, and he was like, absolutely not. Not a medication that he's on regularly. So obviously, if it was something he was on long term, we would come up with a different way, a different flavor, or maybe he would prefer a capsule or a tablet. But
that's why we do the custom compounding, different flavors sometimes. I think that's the only one. And a lot of these, especially the birds, goats, sometimes are direct syringed, so they just take them like that. Nancy has a few that go in his food. We'll get to Nancy's in a minute because he has a lot of meds. And a little bit of fig Newton or even just a pill itself he'll eat because he's very excited to eat. Oh, we have a bunch of questions now. Thank you for your questions. Okay, I know many of her companions tend to hide their discomfort.
Oh.
What are the most common ways they express this, and how do you pick up on it? This is
That's
like being
such
a
a good
detective.
question.
I love this question. Thank
We could
you.
do a whole video on
That's
this. That's a great
There
question.
are a lot of subtle signs.
Yes.
The one thing is knowing the resident really
Totally,
well and
totally.
knowing if their schedule is off,
Yeah.
the way they look. I remember one time Obama had something going on, and just the fact he didn't run away from me quite as quick as he
Right.
normally did, I grabbed him, and he did have a wound on him from
Right.
overnight. So yeah, what would your examples be? There's so many.
Yeah, and actually mine
It's
is
true. Most of the residents here would hide their pain.
Yes, yeah, because basically all of our residents are prey animals,
Mhm.
so they are biologically driven to hide their pain and their discomfort from us, and from their flock mates and herd mates as well.
Yes.
So actually, my example was also Obama related.
Same instance?
No. It was when
We
Obama
love
was
him.
it was when Obama was having some dental discomfort like a couple months ago earlier in the year. He has a very specific routine in the morning, very passionate about fig Newtons, about breakfast.
If you've seen any video about him, he is just so excited.
Yeah, and just one morning that he was like not super excited about it, kind of just chipping away at it, and then the next day still not quite acting himself. So that kind of got
I know
our
what you're
alarms
talking about
off.
now. Yeah.
So that's
And I think you mentioned to me, and I was like, uh-oh.
Yeah.
That, like, I didn't even see it, and I was like, that's something's weird.
So it's very important to know the residents, and then also just what's normal for like the specific species as well. And again, I think we could do a whole video on this.
I think we should. I think we could sit here. I just thought my brain fired off with so many examples, and this is a fantastic question.
Yeah.
I think it's just knowing them, because even somebody like Diablo, we kind of suspected him, but he was hiding it so well because he's such an anxious boy.
Yeah.
But you just watch from a distance, and he was doing like a little like hunch and a little lift with his back legs. And we're like, okay, that must be arthritis. But you have to be a real detective.
Totally.
You have to have really keen observational skills and just always being like, what's that? What's going on? Like a resident not eating is huge. Like even if they are hiding pain well otherwise, if they don't eat and they normally eat and they're excited to eat, which is most of the residents, especially pigs, especially chickens like Nancy, who are bred to be hungry all the time. If I put food down and Nancy didn't eat, which happened not too long ago, he was fine. He just had a weird morning. Immediately, like we
jumped
were both
into action.
Getting ready even to send him into the vet. Like that's a huge one. I think eating's a huge one.
Yeah, totally. Yeah, and specific things for specific like species as well, like a goat or a sheep isolating themselves when normally they're
from their social
flock,
group, even if they're usually like running away from us or whatever. So within their group is a big one.
Signs in posture. Birds, they kind of get like a dumpy
grinding their
penguin.
teeth.
Yeah, there's so
fluffed
many
up feathers on the bird if it isn't cold out. They get fluffy sometimes if they're cold, but they have heated coops. Cats. I did find a UTI on Claudia once because she squatted to pee a few times, kind of within a few minutes. That's not normal. They should squat, empty their bladder, and then urinate a few hours later. But she did that, and I was like, you're going to the vet. And she had a UTI. So you have to be a little this is like
incredible. Okay. We know what we're doing for bear care in a couple weeks.
We know our next video. This is such amazing.
Yeah.
We have a few more questions that have popped up in the meantime. So Joyce is asking, does Sammy or any other have to have cryotherapy for skin cancer? Do you know what cryotherapy is? I'm not sure, Joyce, what cryotherapy is.
It's like a topical like cold therapy of some kind to help shrink skin lesions. I'm not super familiar with it.
I'll have to look into that. Nobody has active, but as you mentioned, Sammy, and you're really smart to know this, as a pink pig would be way more susceptible.
I remember
does get sunscreen, but
when Captain Dan had biopsies done on some of the lesions on his ears,
is really common on pink pigs. Even skin sunscreen every day of the year, they still are more susceptible. That's really delicate skin back there.
Right.
We're gonna look into that.
Yeah, so no one actively, but it's definitely something that we're keeping an eye out, especially for the pink-skinned residents, anyone who's higher risk of skin cancer. So
white,
no one now.
Like somebody who's like a Diablo who's all white, a Denver who's all white might be more prone. Especially around the eyes, I find that such a delicate because they're otherwise covered in hair.
Yeah, I think we were concerned about cancer for Denver with his eye when he had the eye
that was
issue
one of the
a couple years
things
ago.
we were thinking about.
Yeah.
Thank you for your questions. Those were fantastic. If you do have any other questions medications. We have a few more
we
baggies to fill.
Sidetracked.
This is a MedBox episode. If you are just tuning in, we are here to tell you all about our lovely MedBox. We're going to take a quick breather, and then we will be back with you to fill the rest of these baggies in just a minute. Stay tuned. Welcome back. We are back live here in the main barn of our new property at Sheffield, Ontario, Canada, filling up the MedBox. If you wanted to know a way to support the residents and all the medication they're on. Sorry, I keep covering your face.
No, it's okay.
We're in a different setup. We thought we were going to be looking the other way. If you wanted to become a monthly donor, that's the best way to support the residents. Any amount. You can see some of the examples that we just gave you. They really range too. Some of the medications are, it's $3 a month, and some of them are $60. And I'm going to pick that one up this afternoon. We just ordered some more for Ginger, and that has kept her airways clear since May.
Yeah, incredible.
And maybe clean. I don't. It's a bronchodilator, which helps open up her airways, and she has some issues with that. So we are back. Going to fill up the last few baggies. Oh, this one's good. Okay, I'm going to separate. So Nancy and Mary are all clipped together. I'm going to take, Sunny. Mary's not on anything right now. Sunny.
Mary is not on anything.
So let's do...
So we'll start with the pigs or start with Nancy?
Nancy.
Okay,
Nancy's going to take a minute. So each of these is a different medication. So Nancy's on levothyroxine, which is a thyroid med because he has hypothyroidism. I always forget which one. Meloxicam for his arthritis pain. Nicole's getting them ready, shaking.
Yeah,
reconstituting.
This one is a tricky one.
We keep it on its side to make it easier to reconstitute. But yeah, it's super thick, and it gets taken up in a really small syringe. Got to be really specific with it. Gabapentin for pain relief. And pentoxyphylline, which is
this one.
That one.
So this is a medication that helps improve blood flow to the extremities. For him specifically, he's on this because of his issues with his feather follicles and skin cancer. So just to help basically improve the blood flow and the health to the skin and to the feathers.
It's really helped.
Yeah. Like we saw a pretty big difference when we stopped this medication at one point. We were trialing it.
Yeah, our vet recommended trying him off because he says it's not something that you're typically on long term. So I kind of want to try it off, and he really struggles with his feathers. He's actually beat skin cancer twice, 2 different areas on his body. So this is just helping keep those areas healthy. I'm doing the gabapentin again, even though we took this earlier.
Yeah, every time.
We're gonna shake it again. Super important. He's getting 1 ml. Sometimes when you see the bird doses, they're actually like kind of close to goat doses. Birds have a really high metabolism, so they will work through the meds a lot quicker, and birds are more likely to be on twice a day medication versus once. So Nancy is on twice a day meloxicam, where everybody else, pigs, goats, sheep, is once a day. Because birds metabolize super fast. So by the evening, he needs more medication.
Yeah,
so
a lot
he's getting 1 ml.
Really interesting, like species differences and like how they metabolize and how the drugs work for them.
With goats and sheep, it can be really tricky because they have a rumen. So there's a little bit more limited sometimes of what they can get because of the rumen and how they digest things. You want to collect? Yeah. I'm not going to lose track. We normally don't fill the med box. There's a bunch of people watching.
Yeah.
Oh, I have a question from Micheline. Thank you. What kind of baggies do you use? I recently purchased silicone bags that are reusable. Ooh.
Oh.
I kind of like that. So these are nice and thin because sometimes we'll end up with a med box just packed with things. So these are compostable. There's the Ziploc compostable, and we do have some on our wish list, and that's where these ones came from. I don't mind that idea. I like
Especially
that.
for people who are like long term on
because these do
medication.
wear down, and you end up, this
having to
Nancy
replace
meloxicam,
them.
we're gonna have to replace that in a little while. Oh, I like that.
Yeah,
Never
thank
thought
you.
of that. Okay, you want to do meloxicam? I'll do
Perfect.
levothyroxine for his hypothyroidism, not hyper. Sunny has the same thing, so we're going to be refilling hers. So he gets a little tiny tab, like a Tic Tac, but in half.
Yes.
So he gets half a tab. I just broke it in half. You can't even see it anymore. So he gets one half. Sunny gets the other half because she has the same condition. Lost her baggie. And I called you Nancy. Nicole's pulling up.
I wish.
The meloxicam. So we got Nancy's levothyroxine. Do you have Sunny's baggie?
I think it is right here.
Okay, and then we're gonna clip all those together because for Nancy's medication, so all of the birds we direct syringe, redirect pill, except Nancy and except Sunny. The Cornish birds are super high stress. They could easily have a heart attack if they get stressed really suddenly. So he actually gets this in a tiny piece of fig Newton in his food, which he eats himself. We're not putting the pill in his mouth for him because that would be way too stressful. And we've never had to do that because he always eats his pills and all of the medication in his feed. So that one's done. Oh, it's going in the box. I lost track. All right, who's next?
All right. So next we have some members of April's family. So April, Brindle, and Mercy. So they get pain medication daily. So right now Hercules gets pain medication on a less frequent basis. He wishes he would get it every day, but he gets supplements every day, so he still gets his little fake medications.
He gets fake meds. He gets sandwiches at the same time that aren't medicated.
Yes.
Fake meds. I think that's the first time we came up with that term. When way back when he never needed it. That herd is elderly now, so they're all needing medication. But way back when he was young, didn't have any medical issues. Some people were getting medication in the herd that he was in. He always had FOMO. The way he would bust in the door sometimes when he heard us, when he heard the vet there. He's probably one of the only residents that enjoys a vet visit.
Yeah, he thrives off of it.
He gets excited. He's like, I'm getting attention. We did have a recommendation that we do an entire episode about Hercules. So, and then again, so we started with, who was that? Bonnie, tiny amount, and we're on to Mercy at 7 mils. And again, this is an oral med. And how are we putting this in her mouth? How are we giving this to her?
So the meloxicam, most pigs actually do like the taste of meloxicam and will accept it from a syringe, but it is also best given with a little bit of food. So we usually put it in like a peanut butter sandwich or a wrap.
Yeah, they probably would take it like if you were to put it up in their mouth and then
I dropped one.
kind of squirt it out, but you could risk it not going in their mouth and shooting out, or they might get excited. It does taste kind of nice, apparently. Never tried it. And they can grab the syringe. So you don't really want to risk this. This usually gets drizzled. If you saw Hercules' medicated sandwich on a piece of bread or something that they would eat, sometimes along with the other medications. Half an hour before they get this, they get their omeprazole, which I think we're doing too.
Yes, that's next.
Ooh, different order.
Yes.
So we'll talk about their omeprazole. And then we have our last bag. Oh my gosh, it's coming to an end.
Oh my gosh. You got that clip after.
And just a fun fact. Oh, you can't see that number. How do I cover it? I'll put my head there. Nancy's medication for the year. We just talked about him. $2,800. $28.76.20. Yep. That's what he's on right now. That's the cost of his medication per year just for him. So if you become a monthly donor, that also helps with his medication. Okay, we're on to omeprazole.
Yes.
What is omeprazole? These are also the same folks that we just did meloxicam.
Yes.
These are always paired together. And why are we giving the omeprazole?
So the omeprazole is a GI protectant. It's like a gastroprotectant medication. Pigs in particular are very prone to gastric ulcers, and that risk is significantly higher when they're on pain medication. So the omeprazole is given to them before they get their pain meds, about half an hour before, just to help protect their stomach. Basic, kind of like an antacid is kind of like the best way to describe it. And then this is something that again is like specific specifically formulated at the compounding pharmacy.
We love them.
Yeah, and we've tried like a couple different formulations because there is a version of this medication that's specifically made for horses. But through our vets research, we've actually learned that a certain formula is actually more effective for pigs. So
yeah, the horse stuff wasn't as effective in terms of like pH or something. I don't know exactly what it was. So we found that doing it custom compounded was the best for them. And how do they receive this medication?
They get it in a wrap.
A lot of things for the pigs are drizzled on a sandwich or a wrap. We kind of do, this is one of the first medications we do in the morning. That way the pigs are all dosed with it, and then they would get their medication half an hour later. So
and this they love it.
Yeah. They have a great time. They never refuse, except gabapentin sometimes. And then this one is medication that needs to be in the fridge.
Yes.
So we will be putting it back in the fridge as soon as we're done. Everything else is shelf stable, but sometimes you have things that are in the fridge for the residents. That's omeprazole. I'm going to start to get into, this baggie is a separate baggie with baggies in it. Baggies within baggies. So there's a group of birds here that are ILT positive that we want to keep everything a little bit separated just so there's no mixing of syringes and making sure nothing gets mixed because it can be transmitted by respiratory droplets, which is typically 1-to-1. It's not usually like the droplets are on you and then you can give it to them, but that is a possibility. So we want to be really careful. This is Richard's group. ILT is infectious laryngotracheitis.
Yeah.
I did it. Sometimes I can't. So there are a few residents back there on medications. Not for that disease particularly. That's a disease. It's a herpes virus, so it doesn't always affect them. It'll flare up once in a while. At that point, we usually put an antibiotic in their water. These are different medications. These are the rest of the birds back in Richard's group in Dolly's house. The first one we have is Shelly. She's on 2 different things. She's on meloxicam for arthritis pain. And she's on, I never said this one before, Theophylline for as a bronchodilator, which isn't working really well. So we're trying to figure out something for her, but that's her meds. I'm going to do the meloxicam. You can see we switched bottles. The big meloxicam bottle is for everyone else, but just again, so when we're drawing up medications, when the syringe goes in, we don't want any diseases to be transmitted. So they do have their own separate little bottles of things. Oh, Irene, instead of going to my doctor, I think I need bear care.
Oh,
that's so nice.
Our very best.
Oh my gosh. We have one more question. I don't want to miss it because we're busy. When you make the wraps, you use corn or flour tortillas. We buy the wraps made and they are whole wheat.
Yes.
For pigs. Yeah, it's a great question. And we buy bulk and then we freeze them so they're always ready to go, because if you come in and there's no tortillas on your shift, it's a very sad day. You have to get creative, like, how am I going to medicate? We got so used to our routines and how we're medicating. So Shelly's getting a little tiny dose because she's a bird. So she's getting 0.13, which is that little tiny amount. Oral, direct syringed. Yes. That is Shelly's meloxicam. That's hers. Clipped together.
We love our
clips. A whole system. And that way, when you come in the morning and you're here bright and early, you grab your med box and everything is ready. Whoever's on tomorrow AM is going to be so happy the med box is ready for them. We have next. These are all separate.
Yes.
So we have, let's do Ginger's Tributaline. This is a bronchodilator, which was in the little slideshow that we showed. Yes. She gets that to keep her airway open and healthy because she has a partially collapsed syrinx. If you're wondering what a syrinx is, it's similar to the vocal cords on humans. We're not really sure how that happened. It did pop up. She was having some wheezing, some breathing issues, which is a sign that something's not right. And we took her in and she had a CT scan, which showed the issue. So the resolution to that issue is the Tributaline.
And she's been doing very well on it. So she's
been on it almost.
She's been on it since May 2024. And she started doing really, really well. And to this day, she's still doing really well. So it's working very well for her. Very happy with that.
And we're happy when that happens with the medications. Yeah. Because there's no surgical option for that, the way it kind of splits out. And that specific part in her body, she can't have any kind of surgery. And the last but not least, we have 3 more birds in that group, all on meloxicam. So we're going to fill these baggies and wrap up our med box episode. Clove, Rosemary, Dorothy and Rosemary are on meloxicam as a pain medication for their arthritis, and Clove has inflammation in her reproductive tract. She has known reproductive disease. So this is helping her feel more comfortable. It is advanced, so we're keeping a close eye. She's actually going to get her belly drained in a few days because fluids are starting to accumulate in her reproductive tract. So that's why she's on the meloxicam. Thank you so much, everyone, for tuning in and watching us fill our med box. If you ever want to volunteer here and help us out with this chore, send us an email. We can always use some help.
Yeah, such itty bitty amounts.
Tiny. Yeah, we have to look a little bit closer.
Yep.
So these are the daily, regular, almost full medications for the residents. And then there are some one-off things. There are some injections we do once a month, like Cartrophin and Adequin. Those are once a month once the resident's been on them for a few weeks, I think.
Yeah.
So those, we don't draw those up a month in advance. We draw those up on the same day. Denver, and on midday he gets a very large syringe full of meloxicam, which we're not filling in this box because that's a midday box, and I think they're currently using it.
Yes,
because it is Denver's meloxicam day. So exciting day for him. He eats that in
some grass pellets.
Yeah. Yes, so he does not mind getting his medication at all. Thank you, everyone, for tuning in.
Yeah, we had so many
questions. It's the end of bear care, and our med box
is full.
And next week, if you're excited about Bear Care Corner, and we had a lot of press to do this, so we're going to do it next week, is a walk around the property. So stay tuned. Next Tuesday at 1 p.m., we're going to do a little walk around video so you can start to see some of the different areas at our new property, because we're busy developing them. I want to make sure that you see all the changes over time. So, thanks again for tuning in.
Thank you so much,
My name is Andrea.
I'm Nicole.
And we will see you again next week.
Thank you.
Bye,
Bye everyone.